terms of your vision, and I guess the hospital's vision, the board's vision over the next 5 to 10 years, I'm wondering if you could speak to that.
Absolutely. Thank you, Dallas. So one of the first things I did as CEO was change the mission statement. And that was a team effort, working with the board and the senior leadership team and our medical staff. And I believe that new mission statement really outlines that future vision, leading our community to outstanding health. Now, there are typically two reactions to that new mission statement, so I want to dispel both myths right now. No, that mission statement is not meant for the health system to take over everything health-related. We're not trying to take over the world. And no, it's not a blank checkbook that the hospital has finally seen the light and wants to write checks for every cause out there. What it does mean is we have to engage in new and different ways in our community. We have to partner with our community resources, our other community partners, in a way that we never have. And it says community on purpose because health is a community issue. Health is more than health care. Care is part of health. But only 8% of the population gets hospitalized on an annual basis. That leaves 92% of us who never set foot in a hospital in a given year. And so making sure that we understand our role is outside the walls of the hospital as much as it is inside the four walls of the hospital. Looking at things like the social determinants of health. Every single one of our health status, 80% of our health status has nothing to do with medicine. The great care that our staff and physicians provide every day only impacts about 20% of your health status. So if we're going to truly tackle health as a community issue, then we have to start looking at those social determinants of health. And that is something that not one organization or one entity can solve. And so coming together, and we say leading, that doesn't mean we're going to be in charge. There are some situations where maybe we do need to be in charge. There are other situations where there's a community partner who is much better suited and much more capable, and we need to partner with them and help in a different way. And so I think that is really the future vision driven by that mission statement, and we're in the process right now. Last night we had our second meeting to revise our strategic plan on how do we accomplish that. What does that look like going forward, given where healthcare is at, given the state of the affordability, accessibility, and reliability in healthcare. How do we make sure that we are leading our community to outstanding health?